Hello there. So we have the treatment of psychosis, part one today. Classes will dull your mind, destroy the potential for authentic creativity. These lines were quoted by one famous mathematician who later received Nobel Nobel Prize for mathematics, and he was suffering from a severe mental illness. Later it was depicted in a movie called Beautiful Mind by Russell Crowe, for which he was nominated for Oscar award. His name is John Nash, and he was suffering. He is still alive, and he is living with schizophrenia. And this beautiful actress from Bollywood was also said to be suffering from schizophrenia, and later she committed suicide. But most of the stories is not a success stories of this schizophrenic. Most of them are in the community. They cannot take care of themselves and are mostly unmarried, and we see them here and there in the city. And this is the one picture from this is one picture taken in the Bhanu Chowk. So what is psychosis then? Psychosis is the symptom of mental illness. It is not a disease by itself, but it is a symptom of mental illness which is characterized by gross impairment to recognize reality. The person does not realize reality, and it is his thought process is thought process has pathology. And besides being suffering in the thinking process, he also has marked disturbance in personality, so that social, interpersonal and occupational functioning is impaired. And in spite of all this, he doesn't have the insight. Instead, he have delusional perception and hallucinations. Delusion means having fixed false belief. It is the pathology of thought. And hallucination is seeing things which are not there, or perceiving things which are not there. It may be visual, auditory, tactile, olfactory. So it is hallucination. So this person is a typical example of psychosis, where he is wondering where the voices are coming from, because he can hear the voices. That is auditory hallucination. And as a part of visual hallucination, he could see elephants under his bed, and there is delusion of grandiosity, in which he thinks he might be the God, he might be the Jesus. And again, he hear the radio telling him to free all the zoo animals. That must be another hallucinations. And aliens are contacting him. That is also the thought process, pathology in thought process. And persecutory delusion, that people are after him. He is feeling like that. So what are the psychotic disorders? This was the psychosis. So the disorders having psychotic features are schizophrenia, bipolar affective disorder. Bipolar affective disorder is a mood disorder, and schizophrenia is the psychotic disorder. Bipolar disorder may also have psychotic features in the maniac state. Basically, it is a mood disorder. And schizoaffective disorders means having both affective component, mood component, as well as schizophrenic component. Besides, during depression also some may have this psychotic features. Old people might have this psychosis, that is known as old people psychosis or senile psychosis. And different drugs like amphetamine, LSDs, cocaine, etc. also induce psychosis in people. And there might be transient psychotic disorders in which for a while person goes into psychosis. And delirium and dementia are organic disease in which there may be psychotic features. Delirium means acute acute phase or acute sickness that a person during severe illness has, and dementia is mostly Alzheimer's dementia and other dementia that is present in most of the old people beyond 60-70. So what is schizophrenia? Schizophrenia is a typical chronic psychotic mental illness which is characterized by clear sensorium. The person is talking, the person is senses are working all right, but there is marked thinking disturbance. His thought is disturbed, his thought is distorted. So it may be the person may be having positive symptoms which normal people do not have, and that may be hallucinations, delusions, disorganized thought, restlessness, insomnia, anxiety, and aggression. These are not possessed by normal individual. And there may be negative symptoms also. Negative symptoms is something that is absent in the patient but present in the normal people. For example, he may be having absence of emotion. He does not feel bad when something catastrophic happens in his life. Lack of emotion, no enthusiasm, and most of all the important is loss of insight. The patient is unaware of his mental status and his disease. And affective flattening means how does he feel. So he feels neither good when good thing happens and neither bad when bad thing happens. That is known as affective flattening. Poverty of speech and social withdrawal, these might be the negative symptoms of schizophrenia. So it was in 1988, in the height of AIDS epidemic, the editor of Nature noted that schizophrenia is arguably the worst disease affecting mankind, even AIDS not expected. So this is what the schizophrenia is. It is a worst disease, not one of the worst, but it is the worst disease affecting mankind, even more worse than HIV/AIDS. Now, what causes schizophrenia? Excessive D2 receptor activities in mesolimbic and mesocortical areas seems to be the cause of psychosis. We will later come to what are the mesolimbic and mesocortical centers. There are positive symptoms appear to be closely linked to dopamine overactivity, but dopamine hypothesis fails to explain the antipsychotic activity of clozapine and other atypical antipsychotics which have only weak D2 blocking action. Dopamine hypothesis will explain the cause of positive symptoms, but to the negative symptoms it does not answer that good. And again, there are atypical drugs which have no or very less D2 activities. So dopamine hypothesis is not complete in itself. Effectiveness of drug modulating other monoergic transmission in psychosis also points at other neurotransmitters like serotonin and glutamate. So there may be involvement of serotonin and glutamate also. So what are antipsychotic drugs? They are the drugs which are able to reduce the psychotic symptoms, but They do not remove the cause of illness. They do not remove the cause of illness. They only reduce the psychotic symptoms. They are also known as neuroleptic drugs and major tranquilizer drugs. Before their discovery, before 1952, when chlorpromazine was discovered, the patients were doped and quietened, and they were taken away from the community. But introduction of chlorpromazine has transformed the lives of schizophrenics, and most of them can be rehabilitated to produce productive life. So what are the drugs for psychosis? So this is known as phenothiazine ring. This is known as phenothiazine ring. And if to this phenothiazine, if we add a single chain compound, then it will become like this, also known as aliphatic side chain. And with aliphatic side chain, it will become chlorpromazine and other drugs. This is phenothiazine with aliphatic side chain. And if we add a benzene ring with one nitrogen, this is known as piperidine side chain, and it will become thioridazine like drugs. And if we add two nitrogen with it, then it becomes piperazine, then phenothiazine with piperazine side chains like triflupirazine. So once again, phenothiazine with aliphatic side chain is chlorpromazine, with piperidine side chain is thioridazine, and they are also known as low potency drugs. And with piperazine side chain, it is known as triflupirazine and fluphenazine. And this fluphenazine and triflupirazine, and along with butyrophenones, haloperidols, are available in intramuscular form. So they can be given to the patient in acute psychosis by parenteral route, whereas other two above aliphatic side chain and piperidine side chain are not possible to give by parenteral route. Besides, the upper two are called the low potency drugs, low potency antipsychotic, and below two are called the low potency antipsychotics or low potency first generation antipsychotics. Thioxanthines, flupenthiazole, and other heterocyclics like pimozide, they are not much used. And these days, atypical antipsychotics, also known as second generation antipsychotics or newer antipsychotics or novel antipsychotics, have come. They include clozapine, risperidone, olanzapine, aripiprazole, ziprasidone, amisulpride, quetiapine, and zotipine. So these are the new drugs. Among them, clozapine, risperidone, and olanzapine are very much used, so are important, at least from the academics point of view. So what are the antipsychotics and their side effects and their treatment? So this is the most important diagram of today's lecture, CIS. This is the mesolimbic and mesocortical areas. These are the mesolimbic and mesocortical areas. Excessive dopamine in these activities, excessive dopamine in mesocortical and mesolimbic site cause psychosis. And this is nigrostriatal dopamine pathway. So it is the pathway from the substantia nigra to striatum or caudate and putamen. So when we block the activities of dopamine in mesolimbic and mesocortical center, simultaneously activities in the nigrostriatal pathway is also blocked. So Parkinsonian like side effect, also known as extrapyramidal side effects, are seen with especially classical antipsychotic drugs and also with few newer drugs. And this is the tuberoinfundibular system, in which normally dopamine inhibits the secretion of prolactin. So when we give dopamine antagonist, then hyperprolactinemia, because of no inhibitory influence of dopamine, may be seen. So these are the same thing in the other words, excessive amount of uh, dopamine and acetylcholine ratio is more important to if we go into deep. So if the dopamine and dopamine uh, uh, dopamine concentration increases and acetylcholine concentration decreases in the mesolimbic and mesocortical center, we see euphoria, paranoia, psychosis, and schizophrenia. So all the psychotic symptoms are due to excessive dopamine and less acetylcholine activities in mesolimbic and mesocortical area. And the belows are the lower ones are the side effect of the drugs which stop the dopamine receptors. Less amount of dopamine and excessive amount of acetylcholine in nigrostriatal pathway causes Parkinsonian disease or acute extrapyramidal symptoms. And again, excessive amount of and low amount of dopamine and acetylcholine in tubero-infundibular system causes hyperprolactemia that may progress to amenorrhea and galactorrhea and infertility in female, and loss of libido and impotence and infertility in male. So antipsychotics and different receptors. D2 block means antipsychotic action and extrapyramidal side effects, and these antipsychotic action, these extrapyramidal side effects are more with high potency typical drugs. They are butyrolphenone and piperazine side chain like triflupirazine. So excessive amount of extrapyramidal side effect, and treatment of extrapyramidal side effect is to decrease the antagonize the cholinergic with central anticholinergic drugs or amantadine. These are the only drugs that are important. Other dopamine agonists should not be given. And 5S2A and 2C block is the basis of antipsychotic action of newer atypical or second generation drug. And antipsychotics also cause YOS1 block, which may result in drowsiness, possibly weight gain, and this happens more with low potency drugs like aliphatic side chain, chlorpromazine, and piperidine side chain drugs. And some atypicals like quetiapine and clozapine are also famous for causing YOS1 block. And there is again autonomic dysfunction. Autonomic dysfunction means M1 block and alpha 1A block, that is more often seen with the low potency phenothiazines. That means the upper two, and autonomic dysfunction comprises of anti-muscarinic effect and alpha 1A block. Anti-muscarinic effect combines of urinary retention, blurry vision, constipation, and dryness of mouth. And alpha 1A block causes postural hypotension, reflex tachycardia, and inhibition of ejaculation. What is extrapyramidal side effects? Let's look at this patient. Let's concentrate in his mouth. Let's concentrate in his mouth. This is something known as perioral tremor or rabbit syndrome, and as I told previously, extrapyramidal symptoms are good with central anticholinergic. And again let's look at this patient.
Don't do cocaine or anything like that? No? Okay.
Look at the tone, the excessive tone in his oral lingual muscle. He is not able to tell 1 2 3 4 because all the jaws, mouth, neck are tense, and he was given Benadryl, which is diphenhydramine. This is antihistaminic with lots of anticholinergic action. So after that, he seems to be better.